Hello, this is Larry Durbin, Chief Executive Officer of Support Solutions. Welcome. I want you to enjoy a series of video trainings that we've developed to help you in your work here. As you know, we support nearly 500 people every day, and you are one of over 2,000 employees who are a vital part of that work. We've developed these trainings to assist you on the behavior side and on medical and nursing issues. We believe you'll find this information useful to you as you pursue your everyday performance, and welcome.
Hi, I would like to take a few minutes for us to talk about physician orders, which will be something you will be dealing with on a daily basis. Our physician orders will be generated in two types: a routine physician's order, which will come to you from the pharmacy to show you what your orders are to follow, and by individuals going to the physician to be able to get prescriptions. All of these will in turn be sent to the pharmacy to be filled for us to put in place within a 24-hour time frame. Remember, as a direct support staff being in a home in the state of Arkansas, you must only operate by physician orders. They have to be in writing. You cannot utilize verbal orders. When you are looking at your physician's order, you want to always make sure that you can clearly read the physician's order and understand the directions that the physician is telling you to do. You want your name of your medication. You want the strength of your medication. You want your directions. You want by what route, and you always want to know the purpose. Each medication will be listed on your physician orders. It will give you the times that it should be administered. It will also give you a start date. Routine physician orders are good for 365 days a year, unless your service recipient goes into the hospital and a physician in the hospital gives you a DC or discontinue order to be completed. Most of the time, our people do not utilize physician orders for psychiatric medications due to the severity of their mental illness. It may be necessary for them to see their psychiatrist at least monthly or bi-monthly, and the physician chooses to communicate directly with the pharmacy. But when you are utilizing your physician orders, always make sure that you can clearly read the physician orders, you can understand the physician's name, and he always dates his orders. If there is more than one sheet of the orders, please make sure, if you're going on an appointment, that he sign and date every sheet of the orders. It is good if the doctor asks you questions that you are able to answer the questions, so it may be necessary for you to review them the day before or prior to going to the appointment. Please remember that going to the doctor with your service recipient is an opportunity to help educate physicians in the community as to what we require and what we do at Support Solutions. We try to follow the utmost quality of care and respect for our people. This is only a brief introduction to physician orders. You will receive more detailed information as you work in your clinical setting. We also want to address in our session today transcribing different orders to the MOR, the Medication Observation Record. One of the first things we always want to make sure is that our order that we have received in writing is 100% readable and we understand what it says. If this is not the case, please make sure, if you are the person attending the appointment, that you have the physician or the nurse possibly to read the prescription or the medication order to you. Once you receive that, remember, you always want to be able to send it to the pharmacy to be able to receive your medication. Now, when your medication arrives, this medication is either going to be a continuance of a previous medication that you've been giving. If this be the case, there will not be anything necessary for you to do. Simply check what you have on your MOR with your new order and what the pharmacy sends in your bubble pack card that all labels match. In the event it is a change in an order, you must always discontinue the previous order. Then you would put your new order on your MOR. Anytime there is a change in order, you always DC the previous order and then will transcribe the new order. You must make sure that there is an open box on your MOR to do this. If not, it may be necessary for you to have additional MORs to put into place. Now, once you've completed this step, you are ready to transcribe your order to the MOR. The first thing you want to do is write on your MOR in the box the name of the medication. You want to use the strength of the medication, by what route the doctor wishes the medication to be administered, and what your directions are, and also the purpose of the medication. You will utilize your start date, and if it is a timed medication such as an antibiotic, you want to address when it should start and when it should stop. If the medication does not start on the first day of the month, as referred to in the medication policy, you will draw a line through the days the medication was not in use, such as if the medication starts on the 5th day of the month, you would simply draw one line through the boxes for days 1, 2, 3, and 4 to where your medication would be ready to start on the 5th day. If the medication is an ongoing day, you will simply let it continue to run through the end of the month, and then when you get your new MORs for the following month, the medication will be pre-printed on your MOR from the pharmacy and will not require you to do the transcription. In the event you are ordered an antibiotic, antibiotics are given for a certain number of pills and a certain number of days. It will be necessary for you to isolate those days on your MOR. Again, in your box, you would have your name of your medication. You would have the strength of your medication. You would have your directions and your purpose and your route. Of course, in your hour column, you're going to have the times of the day you will give the medication. There again, if the medication is ordered for 10 days and it is the 5th day of the month, you would simply draw your single line through days 1, 2, 3, and 4. Start your medication on the 5th. Show open space to give it the 5th through the 15th. After the 15th, you would simply draw a single line through the 16th and the rest of the month, and with a capital DC, you would put that in those spaces provided for showing it's discontinued. When you are transcribing orders onto your MOR, you always have the availability of a nurse to call to assist you, or you can call the pharmacist to ask for assistance in your transcription to assure that you have this correctly. Remember again, when you are assisting with medications, that you only are able to write what you see exactly on your prescription or what you see on your physician orders. These orders must all match. The end product is, when you are through transcribing your order, you want your prescription that you have from the physician, your MOR, and your cards of medicine should all read exactly the same. This will ensure that you have utilized your rights of giving medication. This will ensure safety for your supported person in your home, and it will also keep all of your staff in accord to avoid any med errors. Now, in transcription of medication, we also want to address when a medication is ordered PRN or as needed. When doing this, the medication should have specific orders from the doctor, such as parameters in what he wants the medication exactly used for. We must at all costs avoid trying to make a judgment call as to why we would assist our person with getting the medication. When you are getting a order for a medication such as Tylenol, if the doctor orders the medication specifically for a headache is all that the medication can be used for. If your supported person came to you with a backache, you could not use the order of Tylenol because it specifically says for a headache. So you may want to keep this in mind when you attend appointments with your supported person, that you may ask the physician to state on his prescription for pain. If the medication is ordered for pain, he or she could utilize that medication for a headache or a backache or a leg ache, and you would be within the parameters of your order. When you give a PRN medication, when you initial your MOR, please be sure to put the time you gave the medication. Then you would flip your MOR over to the back. You put the date, you put the time, you put the medication that you gave, the reason that you gave it. And please remember again, that has to be to the specific directions that the doctor gave you. It's always good when given a PRN medication as needed if you follow back up with the supported person in 30 minutes to an hour to ask them, did the medication achieve the purpose it was given for? Hopefully this will always be the effect that you get, but sometimes it may be necessary to repeat it. When given PRN as needed medication, please remember You do not have a window for giving medicine. If the doctor orders the medication every 4 hours, it must specifically be given every 4 hours. You cannot give it 30 minutes before or 30 minutes after. It must be exactly 4 hours. So if I gave a PRN medication and it was ordered every 4 hours, if I gave it at 6 a.m., I would not be able to give it again until 10 a.m. Please always remember that when you are utilizing medications, whether they be scheduled or they be PRN, always remember that you do have the pharmacy available as a resource person. You always have a nurse available as a resource person. Thank you.